Hi guys, James again. Just want to give you a little bit more detail about the Sporting Hip and Groin course. So the course is fairly complex, but it deals with all the difficult areas you get around hip and groin injuries, in particular in sport, obviously. We're going to deal with how do you assess this complex area, and in particular, understand the biomechanics and why the injuries occur, understand where the incidence and epidemiology lies across different sports, football, rugby, athletics, etc. Understand how do you differentiate between hip injuries that are articular in nature, maybe like a labral tear, versus soft tissue injuries to the adductor muscle group, the adductor tendon, the tendon bone interface. And then also how do you differentiate from groin injuries that are pubic joint in nature to those that are muscular in nature. So the course will deal with all of that on day one, but more importantly on day two, we're going to deal with all your treatment strategies. So once you understand where the problem's coming from, how do you best treat it, whether it's bony, whether it's muscle, whether it's tendon, whether the joint is a problem. Equally, how do you manage the area by understanding the function in this region? So understanding how the hip function influences the groin, understand how the trunk and abdominal function influences the groin, and then equally, how does the adductor muscle function influence the hip? So we're going to cover across all those different areas, moving around, making sure that we have a comprehensive handle across hip and groin injuries. Many thanks. Bye-bye.